Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, the next retinal detachment is we have exudative retinal detachment. Right. In this exudative retinal detachment, mainly due to the tumors, that is formation of the exudate, that is the effusion will enter the subretinal space separating the retina. So it is mainly due to the choroidal lesions like tumors. So what tumors are we talking about? It can be due to melanoma, hemangioma, or it can be due to metastasis, or it can also be due to central serous retinopathy. All these are actually the causes of retinal detachment, that is exudative retinal detachment. Then in the exudative retinal detachment, if this is the retina, there is fluid or effusion is seen in the retina, thus the retina is like this. So this has again convex configuration. Now, here the patient will see floaters are seen in the eye. These floaters are also associated with vitritis. Visual loss is seen because it is due to a tumor. This visual loss is sudden and it will always be progressive, and even it progresses rapidly if it is a malignant tumor. Smooth retina is seen with shifting fluids may be present. Now, treatment is the best treatment of this condition is to treat the primary lesion. So, if you treat the cancer, then this tractional retinal detachment will also be decreased. Sorry, this exudative retinal detachment will also be decreased.
thank you and thank you for watching.